Another tier of funding we have are our major signature projects, and we're going to have a panel on each of those over the next 2 days. And the first one here, it's a 2-year project worth a couple of $100,000. We've got them in 3 key themes. The first one is led by some amazing people from both health and law, and we're going to talk about that. It's a health and justice Indigenous Knowledge Institute research theme. We have Warwick, Eddie and Jayana are going to talk to us. I'm going to introduce you to them all. So Dr. Eddie Cubillo is an Aboriginal man of Larrakia and Padgham of Central Arrernte descent. Eddie has a Bachelor of Laws degree, was admitted to the Supreme Court of the Northern Territory. Throughout his career, Eddie has been involved in a number of organisations and causes, including the National Aboriginal and Torres Strait Islander Legal Service and the Royal Commission into the Protection and Detention of Children in the Northern Territory. He recently submitted his PhD and is working at the University of Melbourne's Law School as Associate Dean in Indigenous and a Senior Research Fellow. He's done so much, but I can't believe you're still so young, Eddie. It's amazing. We have Jayana Dwyer is a research fellow at the Indigenous Law and Justice Hub. She's a non-Indigenous woman who grew up on Wurundjeri country. She's a lawyer with a public service background with a strong interest in access to justice, decolonisation and social justice in her work. And Warwick Padgham is a Taungurung man and the program manager of the Indigenous Law and Justice Hub. In his role, Warwick leads the administrative responsibilities of the Hub, ensuring the Hub's vision is realised. Prior to the law school, Warwick was manager of Indigenous student programs at the University of Melbourne's Poche Centre. Indigenous Health, Poche Centre for Indigenous Health, overseeing Indigenous graduate research student development. He provides advice regarding Indigenous graduate development across the university and its partners, as well as working on projects and activities specific to Indigenous doctoral advancement nationally and globally. So if I can ask you 3 to come and join us up the front here. You'll have to talk into the mic so our online audience can... have we got that other mic that was here?
We're going to talk to some slides.
Okay, do you want to get up and take it in turns? Yeah. And then you're going to sit down for just questions?
Yeah.
All right.
Is that on?
Take it away.
Who's looking after the slides? Yeah, no worries. I just want to acknowledge we're on Wurundjeri country. I want to thank Auntie Di. As always, she welcomes everyone, makes us all feel comfortable on country. I just want to thank Clark for his great presentation, and it's good to see our mob all over the country, relearning and taking back what's rightfully ours. Just want to acknowledge my people. I'm from the Northern Territory. My mob I'm saltwater mob, Larrakia and Padgham, and my father's Central Arrernte, who's a desert person. So technically shouldn't be together, but thanks to colonialisation, that's who I am. And as Auntie Di said, yeah, I'm proud of that as well. I just want to thank you, the IKI, for this grant. As my brother there spoke and talked about me a bit, my background is I've worked in the Aboriginal legal services for most of my life. I've been a board member and I've been a chair of a Aboriginal legal service. So I have some history there. And as we all know, our people dominate the justice arena, and that's due to the way this country was seated. And the white settler law is on shaky ground on how it was brought into this country. We get the opportunity, due to the funding from IKI, to look at health justice space. And just through my PhD, where I looked at the Aboriginal legal services and what self-determination looks like to them. They're one of the, if not the oldest body in this country for Indigenous organisations. some of the interviews that I did, I interviewed Gary Foley, who highlighted that, they went to the US and spoke to the Black Panthers to have a look at some of the community services that they were delivering. And some of them were like Meals on Wheels, bringing back, and the legal service is one of those that they brought back. And the discussion that he gave initially to me in our interviews was that, after the referendum, everyone came off missions and moved into Redfern. So there was a huge amount of people coming in, an influx into Redfern in Sydney. And due to that influx, there was huge social issues, and he spoke about some of the issues with police, which we continually have to this day. And so himself and other identities around Redfern came together to discuss the development of the Aboriginal legal services and what that looks like. And, he spoke about how they went about establishing that. Speaking to Hal Wooten, he was then a dean of a law school and developed this legal services that was fairly ad hoc, but was providing a service to our people who were getting locked up at huge rates, so police could work out the criminal matters for their month. And so we were having a lot of innocent people being locked up and bashed and all sorts of things. And at the time, a huge identity in Sydney at the time, Mama Shirl, went to them and asked them about, well, you're all getting bashed up and we need a health service. And so health justice isn't a new thing, is I suppose what I'm trying to say. They came together and discussed the provision of a health service, and they all met and went from there and possibly worked really closely. And if you speak to Gary, he'll say, once we engaged with government is where we got corrupt, and we were bound by various strict accountability when taking government finances, which separated health and justice at that time. Just an anecdote there that they met, and Gary said there was this strange white fellow in the background, and they asked who this dude was, and he said that was Fred Hollows, and so he was there at the start of the the Aboriginal medical services. So anyway, sorry for that little historical thing there, but I just think we need to know where our history comes from, and Indigenous people have been fighting for a long time in regards to our rights and our ability to provide services to ourselves. And when we're let to do so, we provide some really great services across this country. So anyway, our project relates to the IKI research priorities on law, Indigenous knowledge in maintaining law, governance and social cohesion. This project is at the very preliminary stages. We are only currently in the process of preparing our ethics application. Today we'll share some of our thinking behind the need for research on health justice and our project designs. Can we go to the next slide, please? Just wanted to make it clear that the law and justice people turned up, but unfortunately Shawana and Odette couldn't make it. Odette's doing a PhD and has to go through a discussion with her supervisors and that today, so that's why she's not here, and Shawana's unfortunately unable to make it due to other commitments. This project is a collaboration between the Poche Centre for Indigenous Health and the Indigenous Law and Justice Hub at the Melbourne Law School. Myself and Dr. Shawana Andrews are the co-leaders, and this enables us to basically draw on Shawana's expertise in social work and public health, and 20-year background in Aboriginal health project management and service delivery, as well as myself. As I said to you before, my history is in the Aboriginal legal service space. I also been an anti-discrimination commissioner in the Northern Territory, and I've had 5 years at the National Torres Strait Island Legal Service, learning, all sorts of things in regards to running a national service with very limited dollars and huge caseloads and all of that sort of information, with government reducing your funding drastically, so that there are reasons why health justice is an important part going forward. We're also working in partnership with Health Justice Australia, the National Centre of Excellence dedicated to facilitating and promoting the needs for health justice partnerships to address unmet health harming legal needs. Health Justice Australia exists to understand and amplify the innovations made by individual health justice partnerships and translates lessons into systems-level solutions that respond to complexity. This partnership emerged out of my relationship with the HJA CEO, Tessa Boyd-Kane, and engagement with them through my role as the Executive Officer of the National Aboriginal Torres Strait Islander Legal Service, as well as attending many of their forums, discussions, and speaking. Looking at an interdisciplinary research project, we wanted to work with the mob at Poche to see if there is something we could collaborate on. We wanted to look at holistic concepts of health and interactions with legal systems as a social determinant of health, and health justice partnerships is a way to do this. And as the Associate Dean of Indigenous Programs at the Melbourne Law School, the building you're in, law isn't just, and I hate this term, but black letter law, right? The law is a whole heap of things. Unfortunately, a lot of it's around politics. But that's the reality of it. And looking at our health justice space is a new way going forward, and maybe something more palatable for politicians. Next slide. The project is looking at health justice in our Indigenous community-controlled organisations, and that health justice movement involves community lawyers increasingly working in hospitals and community settings in partnership with health practitioners to assist patients or clients who are expecting health problems that relate to legal issues, but who are unlikely to access legal services due to various structural basis to access. The reality is that people rather go to see their doctor before they want to go and see a lawyer, and the idea is hoping that we could capture any issues they have prior to it's too late, right? So early intervention, basically. Health justice partnership models recognise that people seen by both health and legal practitioners are often experiencing multiple and intersecting health, legal and social needs at the same time. The health justice movement also came out of a recognition that there is no rush to law. Individuals were unlikely to have early access to a lawyer to prevent a problem escalating, and health practitioners were often first contacts who could recognise that health impacts of unaddressed legal dimensions of problems, for example, housing, tenancy law, all those type of things, real basic civil matters that escalate into fines, and people are then eventually on the streets or have had fines that they cannot afford. There is also a recognition that accessing a legal service and seeking a legal remedy often has impacts on well-being that require psychosocial supports. For example, elder abuse law. By working together, health and justice services can provide better, more accessible services and achieve better outcomes for the people they are working with. Health Justice Australia recognise that health justice partnerships are formally operating in Australia since 2013. Models of health justice partnerships come in a variety of shapes and sizes and focuses on a variety of areas of legal services. This might be as simple as placing a lawyer in the office of a medical clinic or sophisticated integration of professional services. We note that there is increasingly a discourse of health justice that refers to equity in access to healthcare and removal of racism and other structural barriers as preventing health outcomes. So we wanted to distinguish between health justice in that context and health justice partnerships. And I'll hand you on to Warwick.
Could I get the next slide, please? So the aim of this research project really is to frame from an Indigenous perspective the importance of working at the intersections of health and justice issues as it relates to us as Indigenous peoples, and to examine the ways in which Indigenous communities are actually approaching health and justice issues from a holistic perspective. So the plan of the project is to examine how mainstream health justice practice models are being adopted and adapted into Aboriginal and Torres Strait Islander community-controlled organisations, but ways in which they're embedding Indigenous knowledges around that holistic wellbeing. So going on from what Eddie was talking around about that intersections of health and justice and how we've been doing these kinds of work for a long time already. So our project will pay attention to the innovation of Indigenous initiatives across the health and justice systems and acknowledge the influence of Indigenous ways of knowing, being and doing in these two approaches. So recognising health justice partnerships as acts of self-determination, this project will also identify the potential impact of these approaches on health and justice systems more broadly. So some of the health justice partnerships which have been established in Indigenous community-controlled settings already include Woodchopperan's partnership in Cairns with Law Right in Queensland, the Rumballara Aboriginal Cooperative Health Justice Partnership with the Goulburn Valley Community Legal Centre in Shepparton, and Miwatch Health had a partnership with the Northern Australian Aboriginal Justice Agency, or NAJA, in the Northern Territory. And there's also a fully embedded health justice partnership at the Institute for Urban Indigenous Health in southeast Queensland as well. Indigenous community-controlled health services are involved in about 20 of the 109 health justice partnerships that HJA recognise across Australia. But this is likely to not include all relevant sites or emerging partnerships as well. So we're looking to get a better understanding on the landscape of that. And the selections of sites for this research study are yet to be finalised, but it'll likely be looking at a few different models in which these health justice partnerships have been established and different funding arrangements that kind of are part of that. So the outcomes from this research may be particularly useful in the context of the new Labor government's commitment to funding justice reinvestment sites and working on innovative justice service delivery under the Justice Policy Partnership. Next slide, thanks. So the research will involve a literature review and followed by interviews with practitioners in about 3 to 4 community-controlled health organisations with health justice partnerships. We're keen to look at the perspectives of people working within these partnerships to better understand, the dynamics of how this has actually been arranged. We plan to interview CEOs of the various organisations, the ACHOs, ATSLs and the peak bodies operating in the jurisdictions of these sites as well. With regards to outcomes and communication of the project findings, we're keen to work with the partner sites to co-develop ways in which our findings can be of particular use for both the existing services and for ones that currently don't have a health justice partnership but are keen to explore it further. However, we anticipate that some of the outputs will include a published literature review identifying the role of Indigenous knowledge in the implementation of health justice initiatives that promote self-determination, a workshop with Health Justice Australia involving participating ACHOs and key organisations such as NACHO, LOACHA and NATSLs to present the findings of the literature review and workshop cultural and practice-based health justice partnership models. Some short written pieces for grounding Indigenous knowledge in practice in publications such as Indigenous X and The Conversation and Pursuit, those kinds of things. We're keen to develop a stakeholder practice report describing the development and implementation of integrative health justice partnerships that foreground Indigenous knowledges, and publicly present research findings in collaboration with our partners and stakeholders. And also with the support of the IKA, I don't know why I'm doing it, but I'm going to undertake a PhD on this as well. But this will be looking at, I suppose, the other side of these partnerships, which is from the community members' perspective. So the experiences of the users within these services. And so I'll be talking with clients who have used both health and justice services within these models, and explore the impacts of how the service integration has or hasn't been of benefit to them. So we think that the PhD will be a good complementary project to this bigger project by looking at how the users understand and evaluate the meaning and values of these partnership services. Next slide, thanks. So this slide really just kind of touches on some of the literature that we've found, in the very early stages of the project so far. There is a fair amount of literature about the systemic drivers of health inequality and injustice in Australia. The Australian healthcare system is recognised as one of the best in the world, yet it's still consistently failed to address complex health needs, particularly of Indigenous people. The inequities associated within Western frameworks of healthcare provision, and the lack of an integrated systems approach to health and wellbeing. And likewise, the justice system continues to target Indigenous people with alarmingly high rates of incarceration and representation in the criminal justice system. And so there's ample literature looking at a lack of cultural safety as a barrier to access to these services, both in the legal and health space, but not so much in how this health justice partnership model might be of benefit to us. So some of the grounding themes that we've found so far is that there is an under-researched link between health and justice. And it's been clear in the literature so far that most people don't recognise that they have a health problem, legal problem until it's too late. And as Eddie alluded to before, they're more likely to consult a doctor or a health worker rather than a lawyer when things are getting really bad for them. So this is definitely the case for vulnerable communities and others that are overrepresented in the justice system. What this is telling us is that there is a growing need for health justice programs in health settings where people feel comfortable accessing those services, and we want to explore that further. So many of the legal issues that health justice partnerships can be particularly helpful for, common in Indigenous communities, are those that relate to social disadvantage, chronic ill health and disabilities, single parenting, unemployment, housing, those kinds of things. And many of these legal needs are compounded with health issues such as stress and physical ill health. Therefore, by delivering these services which address these issues collectively, will go some way in reducing the harm that's caused by them. So there is an emerging literature on the positive outcomes achieved by integrated health justice services through the evaluation of health justice partnerships. Most of the literature on health justice partnerships isn't Indigenous specific and doesn't look at the ways in which Indigenous community-controlled organisations are using these dual delivery methods or models, which are actually grounded in Indigenous knowledges and ways of doing and being. So, it's well known that there's a strong relationship between health and law, and that's recognised. The interface of health, law and culture, however, has received a lot less attention, particularly in the literature. And there are a number of health justice partnerships operating in community-controlled health organisations in Australia, but there's not that much which actually looks at these partnerships in any great detail. Apart from some site-specific evaluation reports, including for the purpose of supporting funding applications and those kinds of things. So we're hoping that our project will fill some of that gap.
Just to the next slide, thanks. So when we talk about health justice partnerships and integrated practice models in community-controlled organisations, the ones we're interested in are ones where there's an Aboriginal and Torres Strait Islander health service or an Aboriginal and Torres Strait Islander legal service, or ideally both organisations involved in the partnership. And we've represented the peak bodies of the Aboriginal legal services and the Aboriginal health services on the slide there. And I should say that's something that at the Indigenous Law and Justice Hub we're very interested in more generally, is the role of community-controlled service providers. Our research here will consider how do the existing policy and governance landscape, both internally and externally, and particularly in relation to government funding, enable or restrict successful health justice partnerships in community-controlled organisations. And that's part of our broader inquiry of how the meeting of these two formally really distinct fields, health services and justice services, enable or restrict access to quality services, the embedding of Indigenous knowledges, and self-determining practices within that partnership. And we're really excited that this project will benefit from Dr. Kabila's really significant experience, as he's outlined, as one of our co-theme leaders, previously as the executive officer of NATSLs, but also as the chair of NARJA, the Northern Territory Legal Service, which has been involved in a health justice partnership. So bringing a really close insight into the day-to-day organisational dynamics, the governance issues, and the politics influencing the operations of these services. Mostly, notably, most of the health services that are entering a health justice partnership with a legal service are doing so with mainstream legal services, so legal aid commissions and community legal centres, and not Aboriginal legal services. And we really want to understand why that is. Both ATSLs and ACHOs have long histories as grassroots community-controlled organisations and provide culturally safe services that meet the particular needs of Aboriginal and Torres Strait Islander peoples. The structure of these organisations has traditionally been focused on community control through specific models of Indigenous governance, though we emphasise, and Dr. Kabila's research has really looked at in the legal space, that there are significant pressures today which limit community control and self-determination practices within community-controlled organisations. One of the themes that's come up through our early conversations on this project is that the Aboriginal health sector has experienced a really long history of working with government through the Closing the Gap framework, while the justice targets and the justice policy partnership on the legal side have really only been established in 2019, so they're really in their early development phase. So there's a longer relationship, organisational experience and institutional architecture and really experience of advocacy and working with government on the health side than the legal side that's supported a comparatively much larger number of Aboriginal health services, so 144 services, in comparison to the ALSs, which have been really reduced in number through successive mergers to just 7 organisations today. Additionally, we've had some early conversations about how to effectively fund these partnerships, where the public health sector relies on a fee-for-service reimbursement through the Medicare model, and the public legal sector instead uses block funding for service provision. So basically, a single amount of funding to their ALSs, which they use to fund as many people as they can. What would be the benefits of incorporating legal service provision under Medicare as we increasingly use a healthcare or public health mindset to think about legal service provision? So if we could get the next slide, thank you. So we wanted to share some really early considerations regarding the design of this research.
Recording in progress.
Okay. We've had regard to the IATS's Code of Ethics and the IKA Charter in developing our own organisational research governance codes for this and our future projects, both within Poche and the Hub. And we see this as really important local expressions of processes of grappling with how we can work above and beyond traditional research governance and research ethics practices and think about decolonising our practices. Many of the organisations we'd be seeking to work with in partnership also have their own local research codes, so we need to think about how to embed these in our governance. Of particular concern to us in our design of this project was embedding Indigenous data sovereignty principles, given that we are working with an external partner, Health Justice Australia, that's a non-Indigenous organisation. In accordance with our research governance principles and ethics processes, we will ensure that individual interview data is returned to those individuals and verified before inclusion in any reports or publications. In agreement with our partner, Health Justice Australia, we'll also retain the raw data from interviews within the University of Melbourne organisation and share only de-identified and analysed aggregate level information with the partner. We've also had thoughts about how to ensure a range of practice models are represented, have a range of voices from the partnerships beyond those directly involved represented in the research. So that might be things such as talking with the Aboriginal legal service operating in the geographic area of the partnership that's not the legal partner to the project. And as the project progresses, it'll benefit from the researchers involved being mindful of the intercultural context in which they're communicating. And their positionality of those partnering in the partnership, especially in the context of HEPs that are partners between Indigenous and non-Indigenous organisations. So we're really excited to understand more about those dynamics. And if you could just go to the next slide. I don't know why I introduced a little signal for that in the last time. So more information about all of our centres can be seen through those QR codes there, or you can approach any of us directly to learn more about this project. And thanks so much for listening.
Thanks, guys. It's great. It's the more you encounter in this, we're constantly non-Aboriginal way is to splinter everything into individual components, and I find most of our job is trying to break those barriers down and get things back the way they should be. So I think this is such an important project, and I'm really glad that it's been funded. So we'll go to anyone in the audience who might have a question on any of this that they might have heard or something related. Yep, can we...
I'm going to ask a rather curly question here. At least I think it's curly. To what extent can we achieve health justice under capitalist parameters? Because I'm thinking of climate justice activists who say system change, not climate change. And some would argue that we need to begin to think about a system other than the present capitalist system that is kind of the elephant in the room. So any thoughts from any of the panelists on that?
It's on? Yeah, good question. Like I said previously, Gary Foley, who's known to most of us, said as soon as we started taking government funds and adhering to government, our responsibility to them, and these are his words, went from minute to a Bible-sized responsibility, which then, puts real pressure on Indigenous people delivering services how they would like to deliver them. And then again, that's just going back to having power on Indigenous people and making sure that we're under control. And I think you're generally correct in what you're saying, but at the moment, both in health and in the law and justice space, things are in dire situations, and I don't like saying the stats, but we're 3% of the population, we're 28% of the prison population, right? And also, our women are the fastest growing incarcerated people in this country. In the last decade, it's 50%. And our children, again, their statistic is very small, but we make up a huge amount of the juvenile justice situation. and I continually quote that out-of-home care by 2037 it's going to triple. So, I mean, that's where we're at, and I throw it back on you who asked the question, and others in the room here who ain't Indigenous and who vote at the ballot box. I mean, that's where the situation is in dire need, is making these governments accountable. You know, Indigenous people become the political football, and elections are won and lost on Indigenous people's issues. So I think you're correct, and but at the current moment, for Indigenous people to survive, there's only so much philanthropic dollars going around in this country, and we just had a pandemic, so a lot of them are, you know, reluctant to put money in spaces at the current time. For example, our hub is launched last year, and we've had no takers in wanting to put money into some of the issues we're tackling in this in the legal profession. I mean, we're currently changing curriculum and challenging the institutions on non-Indigenous thought processes around the legal system in this country and the way it's taught. And this is the hub's people. I mean, there's three, right? We had a review on Indigenous programs in the law school, and we have all these recommendations, and one of them is to establish a hub, and one of them was to pay for my position, but these two positions are philanthropic paid, and one's on research dollars. So, I mean, that's the reality of it all. And then if we, just as we discussed recently, close the gap, that's the most funniest thing going, because you can't close the gap if you didn't have targets initially with justice in it, where people are dominating the prisons, but we're not a part of the close the gap until just recently. So, I mean, are we being real serious about it? And you know, questions could be thrown back on Indigenous people for why did we even go to the table if we didn't have justice as part of the close the gap targets. So, you know, it's a real serious issue.
I'll go. Thank you for your question. Sorry, there's now a lectern between us, so I can't see you. But I suppose, yeah, we would never position health justice partnerships as a panacea or cure-all for all of the problems experienced in the health and legal sector. But I think it is a really exciting movement away from traditional ways of doing justice services. Anyone who worked in kind of community legal or ALSs will understand that there's really, those services are really funded to respond to crisis, so you're never intervening really early in people's experiences. It waits till things get really protracted before you can assist, and part of that is, I think, the way we position people's lack of rush to law is, and they don't access services early, but it's also just the funding isn't there if they did, so most of the time. So I think it's really exciting, the idea of intervening earlier through health justice practice models. Also, a lot of the work that the Hub does is around curriculum and teaching lawyers to work with empathy, humility, humanity, and respect, and that is generally not part of the curriculum. And I think there's something really positive just about having different models, and models that centre people's health rather than just the legal outcomes, working together in professional partnerships, so that can really change the way that lawyers work and help them see their clients or their patients' experiences more holistically. So that's another really exciting byproduct that I hope would come from partnership models.
Great. We've got time for one more. Strikes me that you know, it's not like they're not using the justice system against us, are they? You know, they're just not using it right. They're the one penalising us, but don't they want to help us? You know, and I think that a similar thing goes on. It's just the inequity of it. You know.
Well, I mean, we've had a Royal Commission on Aboriginal Deaths in Custody, 339 recommendations. We had a recent Australian Law Reform Commission Pathways to Justice report that the government of the time didn't bother even responding to. So, it just goes on and on. And there's a plethora of reports just in justice, let alone health, that says things need to be done differently, and these are mostly done by governments on us, but never enacted into make that change.
Yeah. Yeah, it's a great point. What you said before was so true. We vote, and if we put pressure on, we can mitigate the inhumanity of something like a capitalist system by voting in the right direction, and, but is the care there, yeah. All right, well, anyone? No? Okay, so thanks to the panel. That was amazing and such important work. So thanks to Eddie, Janaea and Warwick.